Hi, everyone. Welcome to Counseling with Dr. Lane. I am Dr. Lane, and this is episode two. We're going to be talking about the different mental health career paths that are options to you if you're considering becoming a therapist or a counselor, mental health professional, someone who sits down with someone weekly and provides them with therapy. We're going to be talking about those different career paths. I will share my screen now that has some information on it for you. So, the first career path is to become a psychiatrist. Psychiatrists probably have the most education. They've spent the most time providing uh, providing care to individuals, learning about that care and being in school. So in order to become a psychiatrist, you have to get a doctor of medicine or a doctor of osteopathic medicine. And then you also need to do a psychiatry residency. So people go into their doctor of medicine degree or program right outside of their bachelor's degree. So you'll do 4 years of your bachelor's, and then you'll do about 4 years of medical school plus another four or beyond in residency. And so that's psychiatry. As you can see, I have career path, typical education, clinical hours, and accreditors. So with this as well, you'll probably accrue about 16,000 hours during your education to become a psychiatrist. So as you can see, that's far more than any of the others, and that's because medical degrees, you're learning so much. You're talking about biology, you're talking about how the brain works, and usually psychiatrists because of all the medicate because of all the schooling that they've done, they can also prescribe medicine. And so often psychiatrists are actually getting paid really well to do medication prescriptions for people who have mental health disorders. And so they'll meet with clients less frequently to go over medications and options and that sort of thing. So as a psychiatrist, you might not be doing weekly therapy as much because your training is to be able to do more than that. And so that's the psychiatrist. And for psychiatrists, you'll want to, if you're going to medical school, you want to make sure that your medical school has the correct accrediting or accreditation. Usually, accreditation, there's a body that is over that the profession has kind of highlighted as being over making sure that education programs are meeting the profession's standards and are up to par. And oftentimes, when you go to get licensed in individual states, the state requirements to become that profession are often aligned with the accreditor standards. And so for psychiatry, you have the liaison committee on medical education, and that's for MDs or doctor of medicine, or you'll have the Commission on Osteopathic College Accreditation. And that's for those going for their DO. And so both of these are considered when you go and see the doctor, when you go have an annual checkup with your doctor. It could be a medical doctor, it could be a DO. Um, and then you'll psychiatry are individuals who have specialized training beyond just medical doctors to provide psychiatry. So then we have psychologists. They might have the second most education. For to become a licensed psychologist, you need to get your PhD or to get a doctorate. And so doctorates after your bachelor's degree can take between and it depends on the career path as well. It could be 3 to 6 or 7-ish years. So often when you go into a psychology program, you'll go into it right after you get your bachelor's degree, and then you'll move forward into doing the master's, And you can choose to get out of the program often and just have your master's or choose to continue on through to get your doctorate. And so you'll need your doctorate degree to be able to become a licensed psychologist and provide care, to provide therapy or to provide counseling to individuals. And so psychologists also have quite a few hours, not as much as psychiatrists, but as you can see, about 3,500. And the accrediting bodies for psychology are the American Psychological Association. And then there are master's programs that are accredited. They're called Masters in Psychology and Counseling Accreditation Council. That's the accrediting body that accredits master's programs in psychology. But often when you get your master's in psychology from one of these um, MPCAC, when you get your master's degree from one of them, there's not a license in any state. Psychology doesn't license master's level clinicians or therapists or counselors or psychologists. And so when you get your degree from a degree program that's been accredited by a master's in psychology and counseling accreditation council, you'll more than likely end up actually getting licensed as a professional counselor or a therapist or a marriage and family therapist. One of those two, one of those two licenses is probably what you'll end up getting because you can't get licensed as a psychologist with just a master's. You have to go and get those doctorate degrees in order to become licensed. So then we have the medical doctor type license, the doctorate type license, and then there are a few different options for master's degrees. If you just want to get your master's degree, which is often about a two-year education program, 2 to 3, depending on how full-time you are, then you can do 4 years of your bachelor's degree and then do that 2 to 3 year master's degree, and then you can become licensed as a therapist or counselor. And so the three kind of different master's level programs that you can do are for professional counselors, licensed professional counselors, for marriage and family therapists, or for clinical social workers. And these are three different programs, and they train you in a little bit in three different ways. Marriage and family therapy, obviously more focused on systems perspectives and working with families and couples and relationships. Social work is very broad. You learn about lots of different social programs, and counseling is more focused on interpersonal relationships and the actual counseling experience, sitting across from somebody else and providing them with therapy or counseling. And so those are those three. And they're, like I said, they're trained in different ways. They have similar hours. Social work, you might have to get a little more hours than the other two. And for each one of these hours, each one of these hour requirements as well, there's different type of hours to get as well. I can only speak for counseling, but for counseling, the accreditor, CACREP, that's what CACREP, that's how you can say that acronym, the Council for Accreditation of Counseling and Related Educational Programs, they require you to do 700 hours. So that accreditor requires that. Some programs might require you to do more because their programs are in line with their state's regulations and license. And so sometimes certain states might require more hours, like 1,000 hours. So your program might require you to do more hours. But the CACREP accreditor only requires you to do 700 and 100, 100 280 of those 700 must be direct client hours. So you must have 280 hours of you providing therapy one-on-one or in groups or with couples or with families, providing counseling. And then the other remaining of that 700 can be note taking, supervision, other experiences that you're having at your clinical site, those types of things. And so this is just really broad kind of for all of these, but they can be very more specific on how many hours that you need to get and what those hours look like. You'll also probably be required, you'll be required to have supervision, a certain amount of supervision hours. You meet with a supervisor every week while you're doing your practicum and internships, and they might often review recording of you practicing your counseling skills with actual clients. And so you'll meet one-on-one with your supervisors and they'll have to sign off on paperwork. So there's those masters, there's those three kind of master's degree programs. And there is a fourth one, which is the psychiatric nurse practitioner. That one is more also in line with, I would say, the medical doctor, the psychiatrist, because as a psychiatric nurse practitioner, you're also able to prescribe medication. You have less training than a psychiatrist and similar training to a professional counselor, marriage and family therapist, or clinical social worker, but you can also prescribe. And so you're also more of a nursing background that you have. And so that's that degree in that profession. And so that could take about between 2 to 3 years of education. And you would get a master's of science in nursing or a doctorate of nursing. And so both of those are degrees that you can go into right outside of getting your bachelor's degree. And so um, like I said, all the way to the far right are all those accreditors. And so you'll just want to make sure that if you're looking for one of these specific mental health professions and programs for these professions, that you look for those accrediting bodies as well. So I named the psychiatry one. We talked about the psychology one, the licensed professional counselor one, and the marriage and family therapist one is the Commission on Accreditation for Marriage and Family Therapy Education. And the clinical social work one is the Council on Social Work Education. And then the psychiatric nurse practitioner one is the Commission on College Nursing Education. Another note, when you're looking at clinical social work, there are some programs that are more clinically focused, and then there are other master's programs that are more focused on leadership in social work and social services. And so, if you want to become a licensed mental health counselor or a mental health provider or a therapist, working one-on-one, providing therapy and diagnosing clients with health dis, uh, mental health diagnoses, then you want to make sure you get into a clinical program for your master's of social work degree or program. Sometimes people aren't fully aware of that. You could still probably, I think you can still potentially be licensed as a therapist or counselor as a licensed clinical social worker eventually, but sometimes students who come from those more leadership programs don't feel as well prepared to provide actual one-on-one therapy or counseling. And so that's some important things to note with that as well. So that's a little bit about the different career paths you can take. If you have questions or comments or want more specifics about them, I'm happy to answer those. You can share those questions or comments in the comment section of this video, and I will respond there, as well as I will continue to do episodes to go more in depth on some of these things because as I talk about these things, there's other things to kind of know about that help you better understand some of the things that I'm currently talking about. So those are those career paths, the types of education you have to have, the clinical hours you'll have to do, and the accrediting bodies that you'll want to make sure are accrediting those programs if you want to enter into those programs. So another important thing to be aware of is licensure. So you can go get your education, but then you aren't that profession or you aren't that counselor or social worker or psychiatrist until you are licensed with your state's licensing board. And each one of these professions has different licensing boards, government agencies that provide you a license. And just because you're licensed as a counselor in one state doesn't mean you're licensed in another state. In fact, it doesn't mean that. You basically have to get licensed as a counselor or any one of these professions in just the state in which you wish to practice. And so it's very important that you make sure that the programs that you're going to also align with your state and where you want to practice and what their requirements are. And so often what you can do is go to the state board's website, look up their requirements, and then you can reach out to the program that you're interested in and ask them if their program meets your state's requirements. They can't always answer very directly, but they can try and help you out, because even myself as the department chair at Western New Mexico University, I get those questions. Does this program fit my state's regulations? And if it's a state that I'm already aware of, I might be able to answer that, or a state where I've had a student from that state and I've already been through the process and know, I might be able to answer it. But if it's a state where I haven't had a student from that state, I might have to have the student tell me some of the requirements or look them up with them and see as best we can to see if they fit. And that kind of concern is only more of a concern if it's an online program and you're doing that online program from another state. But if you're in an in-person program and you're in the state in which you're getting education in the state in which you plan to practice in, usually that program is set up to meet the state's requirements. Otherwise, there's not a whole lot of purpose for that program. And so, but you'll want to still kind of double check and make sure and ask the faculty of that program if it meets the requirements, as well as also checking to see if it matches those accrediting bodies. So again, that's a little bit about the different mental health career paths you can take. I'm Dr. Lane, and I will see you on the next episode. Bye.